So I learned a couple of things from this hospital experience that I've just been involved in. Kidney stones, yeah. A lot of us go through it. If you haven't been through it, the odds are at some point you might just have to. The most common age that we get them is between the ages of 34 and 40. Isn't that crazy? You would think that it only happens to people over the age of 50. Well, not at all. 34 to 40. If you take 100 people that are the age of 35, 30% of them will show that they have kidney stones on a CT scan. A lot of them asymptomatic and they don't even know they have them. So, yeah, you might even have them. And how do you get kidney stones? Well, dehydration, and it can happen within hours. Now that was a huge surprise to me. So if you get diarrhea, for example, and you get dehydrated during that time, or you are in a sports match or something like that, and you get dehydrated and you don't drink for an extended period of time, a kidney stone can form within hours. So that was the one interesting thing. Let me tell you about my experience here. So I had a kidney stone that was roughly about 3 millimeters big. By the way, the shape of the kidney stone does matter. Now, 3 millimeters, interestingly, should pass. There's a 90% chance of it passing on its own. In my situation, I wasn't so lucky. It didn't pass. I waited a good month to see if it would pass, but it didn't. So they had to actually go in and remove it. Not invasive surgery, just through the groin area. When they take out a kidney stone from in my case, it was the urethra, which is the tube connecting the kidney to the bladder. So there's two tubes. There's the kidney, and then it goes to the urethra, which is a tube, then to the bladder, and then from the bladder to, I'm just going to say it, to the penis. That is the ureter, not the urethra. So my kidney stone was lodged in the urethra, which is between the kidney and the bladder. Now, what happens there is it causes a bit of swelling. 90% of the time, if the kidney stone is under 4 millimeters, I think it will pass. But mine actually got lodged in the urethra. It didn't block the urethra, but it was blocking a little bit of it. So, we had to actually take it out. And it's quite a small procedure. It's like 101 for any urologist to do. But what happens is when they take the kidney stone out, they actually put a stent in to keep the urethra open. And the reason why they do that is because once the kidney stone is removed, that sometimes there's swelling and the urethra can close, which means that the urine coming from the kidney to the bladder can't actually get to the bladder. And then it's an emergency and you can even lose the kidney. So it's really important that you get that sorted out. Now, for me, the stent was a nightmare. For a month, I had blood in the urine. It really was not fun. And I'm a chronic illness patient in terms of chronic pain. I'm used to chronic pain. I was sitting on a good 6.5 to 7.5 out of 10 pain all the time because of this thing. Couldn't bend over, couldn't run, whatever. And I'm used to being quite physically active. Somewhat, okay. When I say physically active, as in I take my dog for a walk every now and then. But yeah, the stent is not supposed to be so painful and it's not supposed to cause so much swelling and all of that, but for me it did. It was just one of those things. So yeah, that's been my experience for the December holidays. It's been lovely, to say the least. I'm Byron Werbler from Centre Counselling. Let's get you back on track.